dry maggot. Well, I mean, how do you know what that is? No. I simply asked. I said, I wish I could have that dry maggot. Well, I mean, how do you know what that is? No. I simply asked. I said, I wish I could have that dry maggot. Well, I mean, how do you know what that is? No.
Hi, everybody. Happy Monday. Happy MLK Day for anything. Oh, sorry, my microphone's not even in front of me. Oh, my goodness. Oh, I'm so excited to see so many people. Hopefully, so many questions. You're a follower of ST. You don't know much about Foodie. So I thought you would learn. Oh, well, you're going to learn that she likes the doctors about as much as Tim does, and she has as many excuses. Oh, Foodie's a treat. Hold on to your hat, girl. Well, Tim is out, doing as usual, but thank you. Yeah, come and join us. Yeah. Hey, hi. Come and join the link. Hi, Angel. Thanks for joining us. Sammy. Hey, Jennifer. Hey, Jennifer. Hey, Seafood Pie. Hi. Oh, she always knows better. Well, we're actually going to watch about 10 minutes of her live or whatever the heck she's on now. I don't know what platform she's on. And I'm going to keep an eye on questions. I'm going to get my phone too. This is the part where she is the most important part of anything on this video was at the very end. She kills the scooter. She lies about her weight. And then she tells everybody about how she's not going to go see the doctor and how she knows her boil herself, which is anybody who works in healthcare, probably the scare. Now, don't get me wrong. Patients know their bodies. Okay. So in the respect of, pain, when she was asking questions, when she was asked about her pain, well, pain is subjective. So your pain is subjective to you. So, oh, thank you, Lori. Thank you for that lovely gifted membership. Thank you so much. I'm going to try to get down here and make sure I can show that. Hey, come on in. Yeah, happy MLK Day. Yeah, hanging out for a little bit. Yeah, I did release a Sarasota Tim video, and I've definitely gotten under his skin because he mentioned something about the fact that he may not be so rich anymore. But thank you so much for that gifted membership, Lori. Was that you who got it, Angel? Oh, that's awesome. That's wonderful. I'm so glad that you got gifted a membership since you're such a hardworking moderator, Angel. That always makes me happy when you get one. I'm still praying for Irish Eyes, though, because they really do want to have a membership. And they certainly are somebody who participates in the chat. I'm actually going to make sure we get our comments seen, and so your questions can come up. And, make sure that if you have questions about the boil, make sure that you drop them in the chat. But as I was saying, people who, pain is subjective. So when Chantel was asking to describe her pain out of 10, and she was trying to figure out whether, she was comparing it to whether it's like childbirth. Well, that's subjective to you, Chantel. What you think is a 5 out of 10 for pain or a 10 out of 10 for pain might be completely different from somebody else. Everybody tolerates pain differently. So it's very difficult to say, how to tell people how to answer that question. It's probably been the question I get the most as a nurse in my career, was asking people to describe their pain out of 10. And they would always be like, well, what do you mean? And and we can't tell you. We would love to have a technology, and I know they are working on something which would actually help us really be able to tell if somebody really is experiencing pain and to what levels. Because obviously we've also have people who exaggerate their pain for reasons you may be surprised to know can potentially include controlled narcotics. And leading into that, I did want to preface, and I know everyone loves to hear it, but I just have to say this as a disclaimer. If anybody is new to my channel or anybody happens to stumble on my channel in the YouTube algorithm, my name's Ray, otherwise known as Life and Vibe. I am a registered nurse here in the United States, training to be a nurse educator. So I'm 55 credits into my graduate program, and I only have my clinicals left. So I'm pretty much completed a master's degree in nursing and as a nurse educator. And so I do not treat or diagnose anybody. So anything that we're doing and talking about as far as Chantel and her boils or anything of that nature is just for entertainment and education purposes only. Never treat or diagnose anybody here. Always want to preface that. But I am obviously a registered nurse, and I do have expertise in subject matter, especially when it comes to things like wound care and things of that nature. Often the wound care experts that you have are nurses. We're the ones who take additional certifications and really take care of the wounds. Often what doctors will do is culture the wounds and obviously advise a treatment plan that they will order and sign off. But once that goes into action, it's going to be the nurses that will be managing the majority of that. If you've ever had to have anybody with a wound vac or anything of that nature, anybody coming into the home health, it's the nurse. So obviously, we do carry a certain amount of expertise. Yeah, it's just for educational purposes only. Yeah, but we, for those of you who do have interest in, maybe finding out a little bit more about my thoughts as to whether Chantel should just continue to know her boil, then let's get into that. And make sure that you do hit the likes on the way in. It's a great way to support the channel and let people also know that we are here and we are live. I think I ran out of my opportunities to let people know about it because I posted. I think I posted 3 times. And so I will be, because I posted a short, and I don't know if that counts as a, 3 times out to my subscribers, because YouTube gives little channels like us 3 promotions out to people. So I don't know. And obviously I have Tim stuff coming out. So this is awesome. Oh my goodness. Such a perfect for you. Oh, thank you. Thank you. Look at this. I love this. Oh my gosh. This is going to be, I hope no one's eating. You posted on X. I appreciate that, Sammy, because I have a troll Twitter account, and it's got a troll name. So I can't ever use it. And I got locked out by Elon Musk of making any changes, even though I'm putting my password in. I have no idea. So, and I don't really have like a ton of sock email accounts, guys. So yeah, like I say, you once pulled your groin and it felt so good you pulled it again. Oh well, dear. Oh dear. Well, I don't know if I can fix that. So you said, what did the little scooter do to deserve this? I heard she drove it into the middle of the street, which makes me think she needs a cognitive exam, and not just an exam for her boil. So I'm not too sure. She got her scooter early. I guess she was going to lose weight. But we'll hear what she claims to weigh. This is thanks to the channel. I think it's Looney Tubes. And I've put the links in the description box below. And thanks so much to this creator for always kind of getting the videos and shortening it to a nice condensed video that I only have to pick 10 minutes that we can have a little look at. And then hear her excuses, and then we'll take some questions. And I know I had some questions, And so we'll bring up the questions if they came up in my community tab on my channel. All right, guys, let's get into this. I have her at normal speed because I want to see the scooter strain. And before I get started, sorry. I know I keep saying this. I'm going to have a sip of tea. Thank you. I appreciate you saying to hit the like for me. I appreciate that. Yes. Thank you. Thank you, Sammy. Thank you. So Elon Musk. So I have concerns with somebody starting to get a scooter, and one that's so easily used inside of that very bare apartment, because Chantel is extremely immobile for the best part of the day as far as not exercising. That couch is going to be having a sinkhole in it in a short amount of time after she just continues to stay in it after a while in one spot. I don't see for that couch not having an imprint after a while. And there's nothing worse than somebody who's already very sort of not wanting to get out and not wanting to get exercise, which I think goes to a question that I think, was it Catherine? Was it you? Somebody, I think, I'm going to take a look because we'll see it, asked me about whether somebody like Chantel could suddenly turn her life around and, reverse her health issues. I think she's done so much organ damage at this point with the diabetes type 2 that she's going to have it's always going to have an impact on her body, even if she were at this moment in time just to really buckle down and get healthy. Getting a scooter and not walking and becoming less mobile than she already is a recipe for declined health. Now, is this an excuse for her to begin to start disability in Canada and get money? I've heard it's not very much. It has a cap on salary. So I wouldn't think that's a very wise plan, but you never know what Chantel thinks is a way to get money at this point. I just certainly wouldn't recommend it. I think it would exacerbate her type 2 diabetes. One way to manage is through lifestyle. And obviously, if this is not going to help her even walk across the street to a supermarket for a little tiny bit of exercise every day or so, it's just, what hope does she have at this point? Yeah, I mean, thank God the scooter will break down so that she'll be forced to walk. I'm glad sometimes when they break down or run out of batteries in the supermarkets, because it forces her to have to walk, especially if she's right at the back of the store. It's the best thing for her, to be honest. All right. Take it away, Chantel, because I think the scooter dies at about this point. Oh. What? She's... I'd be curious to know what, because are the filters still on at this point? Do I know if this is like pity? I know I should have put some music on in the background, but I don't probably. This is supposed to be a professional moment of Q&A about medical stuff, so I don't really want to laugh at somebody. But that's a pretty on point thing to say, Catherine. But I can, imagine living below. Beep, beep. They're trying to figure out what's going on. This waistline, my goodness. She is going to say she's 344 pounds. Do we know if there is any, because, okay, if we were to measure her waist, I can't imagine what her waist circumference must be. Look at how she's like spilling over the little seat here. That's waist circumference to her height and so forth. That's always going to be a really bad indicator of health. Now, is she wanting the scooter because the boil irritates her as she walks? Gosh, she's pretty. Gosh, she's almost wide as she is tall. She's a couple of feet wide. That's not just sitting down. I mean, we're all probably sitting down. So sit down and kind of look at your side and just trying to imagine what is, wow. I know she's tiny, but this is not healthy. She's fine. She wants the scooter. She not breathe when she goes anywhere. She's made herself almost immortal. Oh, immobile, I think is what you're trying to say. Not immortal. Then she'd be like Edward from that vampire thing with the kids. I don't even know the name of that one with the vampires and the werewolves or whatever. Beside the boil. Oh, she does, but the problem is that's that could be not just a pulmonary issue. People often think when somebody is short of breath, the reason why she's short of breath is because her lungs are what is the issue. And in reality, that is coming more from a cardiovascular, because her blood is, her heart isn't working well enough, leading to her being not good cardiovascularly and therefore leading to the shortness of breath. So it's coming more from a cardiovascular standpoint often than a pulmonary. People often mix the two up in some ways. Not that having good lung capacity isn't important, and she obviously has terrible lungs because she's on a CPAP. But there's so many things that are messing up with her heart too, because the fact that she's probably gaining some insulin resistance, shown by the introduction of insulin into her medication. I mean, I don't know if she's on that. But in long-term, uncontrolled type 2 diabetes, it's going to have a really massive effect on her. And then if she has a boil and she says she knows her boil and the boil has been there and it's like in the same spot and therefore not healing. I mean, there's a lot of things that could be happening, but one of the largest contributors to the boil not healing is always going to be her type 2 diabetes, because anybody with type 2 diabetes has a very compromised immune system or not immune, but they're healing. They don't heal as easily or as well. All right. I'll make sure the mods make sure you let me know if somebody, does she smoke? Well, we know she smoked the shisha. But I don't think she has been in here recently. Mods, make sure I somehow find out which of the comments or questions I need to answer if they come in. All right, let's keep going, Chantel. Oh no. Oh, that's the reverse. Oh God. What's happened? Oh no, I'm just trying to get a sense of her posture and stance. Now, most of you are probably better than this. She eats gummies now when she's got the money. Does she? Oh my gosh, it's the way she tilts forward here. This is because of the weight, obviously, from the abdomen is just like literally tilting her like downwards. Gosh, that's so much strain on her back. Oh my gosh. And that's why when she walks, like she doesn't bend her knees. I don't think her knees can even take the strain of that. So this is very concerning. When you're thinking about somebody in their cardiac health, and obviously she doesn't have good cardiac health. Again, she's not going to have good healing. That boil though, with the type 2 diabetes, that's going to be really bad. She should not. She's not bending her knees. Yeah. So she definitely she sounded out of breath just coming off of the scooter. Now that's because she doesn't have good cardiac function, in my estimation, in my opinion. I have a lot of experience in cardiac nursing. So probably a lot of you know, because a lot of you, but if you are new to me at all, my original experience was in cardiac nursing, and I've spent many years, including procedural, in the progressive step-down care units for cardiac. Obviously, with cancer patients, you have to watch for cardiac issues too. And then obviously I worked in a cardiac rehab, and then in hospice. A lot of my patients, because cardiac disease is the number one killer still of people globally, I obviously took care of a lot of cardiac patients. So a lot of what we hear when Chantel's short of breath is actually, you would be scared of that ball. I think she should be too. Because if it's not healing, what you do want to be concerned about is any non-healing boil could have potential to become necrotizing fasciitis. Necrotizing meaning necrosing. Fasciitis meaning the fascia of the skin. That's sort of layers in between the dermis areas. And once that happens, it can be deadly. It can become septic. People who are type 2 diabetics can be extremely prone to these types of disorders. And Chantel, with potentially poor hygiene, not getting really in well between the folds of the skin. Everybody carries a little bit of aureus, Staphylococcus aureus on the skin. I think somebody was asking me about MRSA, but we'll keep looking at the scooter because I think she talks about the boil. So we'll let her continue with the scooter. But oh my goodness, this is, like I was saying, in cardiac, sorry to get back to that, one of the things that we measure is a patient's waistline, because there is evidence to show that the waist circumference of an individual is also a good indicator of them having cardiac disease in the future, if not already. In Chantel's case, I don't want to laugh. But my opinion is that, knowing everything that she's got, anytime they probably are discharging her from the hospital is because everything that she presents with are chronic diseases most times that need to be managed in a primary care facility, not in the hospital. Chantel will end up in a hospital really, really needing it. One, because she becomes all dehydrated and obviously being diabetic and the sugar and just the amount you need to urinate. Becoming dehydrated and being a diabetic just go kind of hand in hand if you're not, but trying to drink water constantly, So, and if she gets any type of illness or anything, it's very easy for diabetics to get dehydrated quite quickly. Yeah. Poor Chantel. And she doesn't check her teeth or do her feet or anything. Yeah, thank you, Lisa. Yeah. Oh, it's absolute overtime. Yep, especially for ladies.
This is really slow.
No, and Chantel was kind of forced into an early menopause by having a hysterectomy. And one thing that was very important for her to do was to make sure that she was staying on a progesterone supplement. I think it's progesterone. No, estrogen. Sorry, just estrogen. So she would have just been taking, I think it's just, progesterone, estrogen. No, I'm starting to forget. If you've had a hysterectomy, you take, I think it's progesterone and estrogen. And then if you are not with a hysterectomy, like you just have a natural menopause, you just would take, I believe, estrogen. Because I think, or something, I can't remember. Don't quote me on that one. I used to know it off by heart. But it's dependent. So whatever it is, I think it's the other way. I've written 1,000 papers. I can't believe I've forgotten it. I'll figure it out. She needs to have taken those in order to not have gone into menopause. By not taking those, which she's very bad about doing that because she'd rather gallivant around than take care of her health. Not because she hasn't had resources and not because she hasn't had access to healthcare. It's really just by personal choice with her. And it would have brought on menopause that she's well into menopause. That's why she lost all that hair and stuff. Sorry. Let me go back to the questions too. Look at that poor Scooter. Oh yeah, any type of hysterectomy, even ovarectomy. So if she had an ovarectomy, did she just have the? I thought she also had the hysterectomy too. Didn't she have both? It's the difference between whether you still have like your womb or not. And if she had, did she have the womb or was it just the ovaries? An ovarectomy. Yeah. She had both. Yeah.
Did I break it? Oh, this is for drive. Why is it beeping?
Oh,
it's dead.
Oh, Lord. Oh no, another scooter has a funeral. Oh no. Is she gonna send it back and claim that she's, within the weight limit? Chantal, that's a clear indication you probably exceeded the weight limit of the vehicle, of the scooter. And it is just estrogen, actually, if you've had a hysterectomy. So I was initially, I want to make sure you have to have a estrogen only. And if you're intact, you need estrogen plus progesterone. So it's different types depending on which, but she needed to take that and she didn't. I think it's, gosh, I'm trying to remember. I used to have to give these to lots of ladies. I forget. I do pediatrics now, so my medicine is in a little bit of a different place. But I never can forget the cardiac and the type 2 diabetics. That stuff's etched in my mind. My other more experience has been with my breast cancer patients. All right. Chantal.
We have to charge it. It wasn't charged like at all, hardly. It had an orange and a red bar. So we have to make sure it charges like full. And it's not going to last long, I don't think. We have to see how it is when it's fully charged because that will tell us what we need to know about it.
You know what? I'm always kind of glad Chantel at this moment has the scooter because this might be the most amount of up and down exercise and moving around she's done for a while off that couch. You did? Well, and are you taking, I'm guessing, a estrogen only? You with fibroid? You're fine though? Oh, well, I'm glad it went well. And fibroids, I know, are very painful. Very painful. I'm sorry you had to go through all those because I know they probably had you go through a few before anything was, and that's a tough decision because a very close friend of mine had the same thing, unfortunately. So I'm so sorry, Catherine. I'm so sorry. Hey, I had early-ish menopause. That was normal, but early for normal. That didn't make me feel any better. Yeah, but it's nothing in recompense. So I'm just gonna stick to Foodie here, bending over. It's just like I said, no, it's not. It's all good. I'm glad. Thank you. I appreciate that. Oh, goodness me. Look at Chantel here. Is that how she couldn't even just be bothered to put these things from the scooter into the darn into the box? Come on, Chantel. Don't be that lazy girl. God.
All content creators ask for money.
Put on anything?
Where's that knife? I don't want to use it in the apartment because I have to turn around weirdly. I'm going to test it tomorrow.
Because I know that's generally the rule of thumb here is for people to go onto a hormone replacement. I know my mum did after she had a hysterectomy in the UK, that she was taking estrogen.
When it's fully charged, if it can hold a charge for a few hours while I'm on it, I'll keep it. It's really small.
Few hours?
Oh yeah, I'll just bring the charger. But if it has to charge for 6 to 8 hours.
You know, Chantel, it's not a bad thing. You should be just trying to find every way to exercise and walk. I really have a feeling this is a further downhill trajectory for Chantel improving her health. If you have a patient and they came into you and with this okay, so in order for her health to really be addressed, she's going to need to address whatever are her compulsions and impulse control issues. Because if she's still acting out whatever her compulsions are with food, or she's still having any other types of issues, then any type of treatment or therapeutic regimen is going to be difficult to administer to her. Seems, especially because she doesn't, it's hard when you kind of look at somebody and you're like, you're destroying your health. I mean, she really is. I mean, back down to the couch. All right, keep going, Chantel.
We'll be at the mall sleeping over. Yeah, I saw Pixel online. It looked bigger than that for me. Anyways, I'll charge it fully, and then tomorrow when we go live, we can try it. Yeah, that's my weight, 344. I weighed myself on camera.
I know that poor cat.
It looked like you were balancing on it. It's actually not too bad for comfort, like honestly, but yeah. Okay. It might have to stay parked. I don't know if it's a pain in the ass to return. I'll just wait till I'm skinny. It's going to be worse on pavement. Yeah, I still use it.
Chantel, you're not going to get skinny if you're kind of headed towards a scooter. You're not headed to the gym. You're headed to the scooter. Scooter isn't getting you to the gym. And you probably feel short of breath, Chantel, because that's a sign that you're probably getting decreased heart function. And if you have high blood pressure, and I was looking, and obviously her blood pressure is a combination of different things. It's obviously her lack of cardiovascular exercise and just, her being overweight it puts a strain on the heart. Obviously, when you have a diet and all this adipose tissue causes all sorts of inflammatory issues in the body that can cause problems to the heart. You have the diabetes and all the different things there. All of those, the diabetes obviously changes like venous structure. That's going to change how the heart's able to deliver blood around the body. And then over time, if you have high blood pressure and you are as inactive as Chantel and is in poor health and also not taking care of your dentition, all of these things, you are going to start to have enlarging of your heart muscle. So it's going to start to what they call hypertrophy. So your heart muscles are going to start to enlarge as the heart muscle gets bigger, or the walls thicken, I should say, because that's what's making the heart bigger. As it thickens, it obviously means the heart is too thick in the walls to give that proper sort of like squeeze of the heart muscle and get the ejection out of the blood in order to send it around the body. Then, with it coming, because it's going to send it to the lungs, it's going to come back through, it's going to come back down into the left atrium, into the left ventricle, out the left ventricle, into the aorta, and then the aorta takes it out, oxygenated into the circulatory system. And if you are retaining more blood than you are ejecting out, then obviously you have a decreased blood flow and you have less oxygenated blood getting around your body. Therefore, you're going to have less energy, and you're going to have things like somebody like Chantal sounding short of breath. And it, like I said, it may not just come from just the lungs per se, but from the heart muscle itself, not giving her enough energy, and then obviously her sounding short of breath. But a lot of times it comes from predominantly a cardiac factor. The CPAP is needed because she's obviously got apnea, probably because of her weight.
Still gonna be lazy. I'm just joking.
Well,
come and pick it up for you. Yeah. Oh, they'll come pick it up. Will they box it? Yeah, 15 pounds. Unless it's really just a 300.
But Foodie said I wasn't a nurse.
Because online it says 330, but
I'm not a nurse. Well, I'm a registered nurse. I mean, trained to be a nurse educator. I was trained to be a nurse practitioner, but it's too much school and I'm getting older. And I said, I want to finish my master's. And I was so close. I said, I'm just going to finish out as a nurse educator for now. If I want to finish or if I want to continue and then take my MP, it would be very easy. I would just have to do the MP clinical. I wouldn't have to take any extra classes or anything. And, I might even have a certain amount, just a sort of fast tracked. So it's not, so if I wanted to still be a nurse practitioner, I could be. It's a lot of school. It's a lot of clinical, I should say. And I have to work. I got bills to pay. And yeah. So no, I am a registered nurse. I know she likes to say I'm not. A lot of people like to say I'm not what I am. Did they probably actually believe me, or other professionals who talk with me and understand that obviously I'm somebody in the field? All right, keep going, Chantal. Because this isn't just off Google, All right, keep going.
M2. I'm just looking shit online. If they okay, there's a section called hill climbing. Yes. This scooter has been tested to climb on an incline of no more than 8 degrees with a maximum user weight of 300 pounds. Do not attempt to climb inclines greater than this.
So when you were purchasing the scooter, did you just look at the price, or did you actually kind of look at what weight they were able to carry? Because Chantal, you were going to need the big boy Maxo. And you're not. You got to send that thing back, girl. You haven't seen 300 pounds in probably 8 years or more. And with your lack of will when it comes to anything health related in reality, I don't see you getting down anything, and you're never going to be a candidate for weight. You're gonna have to find Dr. No is probably the only person who would be prepared potentially and to put you on the table. And you would have to follow a very strict diet after, otherwise you blow your your band or whatever they decide to do. You're a high risk too because of the CPAP on a table, Chantal.
Yes. Charge your batteries for 8 to 10 hours before first time use. It says right in the manual. Okay, here we go. Let's see. Max user weight 300 pounds. They're fucking liars, scammers. Let me give them shit right now. That's false advertising. If I got injured or something, I'm still over the weight limit though. But if I was under 300 pounds, or you know what I mean, like scam, I'll have to call them. The advertisement.
Any scam is you try to convince people that you're anywhere near 300 pounds. That's the scam, Chantal. I I mean, you're a tiny person. So, but when I see that your waistline and all that adipose tissue, it weighs, it starts to get heavy. It's not vasculated. It's just mass. Girl, I don't know how much she weighs, but it's not 340. She's over 400 for sure. I don't know if she could be pushing 5 because I've saw her in the 300 range before, and seeing her at that range and seeing her now, I would say I guess she is around over 500 probably. I know that just because of the fact that she had to have 6 liters of. It's okay. It's bin. It's bin day tomorrow. Everyone's putting their bins out tonight, puppies. It's okay. I know you're valiantly stopping the neighbors from putting the bins out, but you're all right. Anyway, yes. And I'm trying to figure out what she's looking at on her screen. Is she trying to find the scam? Scam, Chantel, is what you think your weight is. Cool. The problem is that unless you get, the only time there's been an honest weight was that ER visit, or anytime you've actually stepped foot into a Canadian hospital setting. And anytime you've had that, you've blacked out the little piece of paper so that nobody actually knows your weight. But when you required 6 liters of fluid in order to get rehydrated after you got sick from food poisoning, probably from a dodgy Chinese buffet, that you, or norovirus, one of the two, or both, maybe. You needed 6 liters, which was an indication that your weight's up there, girl.
Says 330. When you even go to the product and you scroll, 330. Do you see that, Swag Daddy, or are you blind? There you go. Doesn't matter. I'm a lot further now by 30 pounds. No, it's not. It says right in the manual. In the
I know. And then she's back down in the. What is she trying to say? Something. She's. Am I reading this? Well, Chantel, it says something else on the box.
Specifications. Maximum user weight 300 pounds. Yeah, I was reading the incline. You think they will? Oh, well. Oh, I don't know. It's false advertising. I wouldn't have bought it, I'm not going to be buying another scooter right now.
Oh, that's a lie. Is it one of her Beezers? Did one of her Beezers purchase the scooter? And now is she going to try to get the cash back? Would it not just be sent to the people? Amazon return? Would the people who purchased it, though, would they not be getting their money back? That's my question. Like, if you gifted somebody something and then they returned it, if they returned it and they didn't want to exchange, would they then be able to pocket the cash? Third-party seller? I don't know, because I don't do Amazon. That's why I'm acting so stupid. The only time I've ever done Amazon is like when people used it for wedding registries and stuff.
Expensive. Oh, it says max capacity weight in the thing is 300. I'm looking if it says anywhere here. It doesn't say. The scooter features an adjustable handlebar and an extra long footrest of 18.9 inches, ensuring a comfortable, let's see, it's not 18 inches, is it? That's all it says. What is the weight capacity? The weight capacity of the electric scooter is 330 pounds. It just looks like it's a small scooter. But what can you get? You get what you pay for, I guess, right? By the way, I'm not going to that doctor. I decided to...
I won't likely ask a disabled person to pack it up for a return. Well, see, I know for certain items, if it's a certain price, they don't require for you to send it back. I remember from years ago. I was surprised. I was like, really? This seems like people work this one out. They would be doing it all the time. But that's probably where people get in trouble. So I'm guessing. I have no idea. That's not my area of Amazon is not my area of expertise. I know somebody in my family works for Amazon, so maybe they're an expert. I probably I think more at the corporate level. Okay.
Like, I don't know. It's too far. I need to find something close. So I'll have something soon anyways. And I also want a female. I don't want to be talking about FUPA with a male. Yeah, I don't want a male doctor. It was a male doctor. I don't want a male doctor. So I'm going to find a female doctor. Yeah, and it's really far. Like, I want some.
Really? She can't wait for the 700 back. Oh, yeah. Oh, well, we know that. She's going to get the refund herself. Oh, these people are masters at the grift. And if we always say their audiences are, willing to part with the money and do so, then, these people will continue to, do their grifts and cons. They're not exactly, motivated not to. Every time Chantel does one of these things, somebody in her audience decides to show up with the money. It's like, Tim, when he needs to have a free dinner somewhere, he's willing to go and sit somewhere and take himself to somebody's house and bring his laundry for the wife to do. To me, I'm just so grateful when people obviously send for something like this, a smaller, audience with Chantel and stuff. I'm not throwing up my troll buy me a coffee like when I do Tim. Now, obviously, do I have it in my links here? Yeah, because that comes up with Nightbot anyway. And we always appreciate it. And it's a way to also troll the people we're making reactions around. And I actually come with some real expertise. So if you want to help me pay for my nursing degree, which I'm still paying on, sadly, even after all these years, and my graduate studies, I appreciate it. All right, Chantel, let's get into this. So I'm going to bring up some stuff about boils.
I'm closer if possible, but I don't know. I'll keep looking. I care. I want a female doctor. That's what I'm comfortable with. It doesn't matter if it's 30 pounds of stuff or 30 pounds of people. 30 pounds is 30 pounds. I've had the same boil. This is the 4th time now. So I'm not going to go unless I'm infected or, Yeah, Deb. Because it's all I can afford. Pineapple Expressway. I've explained this.
What's this? Oh, what is the only thing that she can afford? Pineapple Express? Way. And how do you, one thing you don't want to do is potentially, have yourself have a boil pop on your skin without it having, professional attention. And if it's anything, you have a certain amount of Staphylococcus aureus that lives on top of your skin, that's why it's important to clean and bathe, and why for people who are not can easily get skin infections and skin boils and stuff. So it's partly hygiene. It could be like warmth and stuff. Is she? All right. I'm trying to get their like a hold on. Keep going, Chantel. I'm just going to pull up something. Keep going.
Ad nauseum, but I'll explain it again to you because it was on sale, because I was supposed to get it at the end of February, and I thought that I would have time to lose a bit of weight. Whether that would happen or not is irrelevant. You asked me why I would order it. That was my thought process. I know my boil, people. You're welcome, Pineapple.
No, that's always one of the scariest things. Like I said, people know their bodies, but still, it's really not a good way to do stuff. So we're actually I'm gonna bring over in a second when she's finished something about kind of like how to treat patients with these types of skin infections, and how you have to worry because of what I was speaking about, the Staphylococcus aureus, Staph A. And, that's one of the things that you need to become concerned about because it can become MRSA. And that's really scary. All right. So let's get over to Chantel finishing out about how she knows her skins and boils. Okay. Keep going, Chantel. She's,
you know what, Pineapple? Sometimes people ask me the same thing over and over just to be annoying, so I can't tell who is doing what, Gold Bond Medical. I have baby powder cornstarch. It's not that much over. It died fast because you're...
Yeah, we're gonna see if the cornstarch and the baby oil is what's recommended, because that doesn't sound like a warm compress to me. One thing that I'm pretty good with is wound care. So I've had to take care of some horrific looking wounds. Horrific. And wounds on people who were dying that it was just more for family comfort than for patient care.
You're also supposed to charge it fully. You're supposed to charge it 8 to 10 hours. Yeah, if you can return it, sure. I'm gonna leave it overnight and judge if it's gonna be okay tomorrow. I really don't give a shit. I'm gonna complain and I'm gonna return it if it's a piece of shit.
Oh my gosh! If anything, that stuff is making it absolutely worse. It's not. Oh gosh! We're gonna actually take a look at what a family practitioner, like a guideline that basically going off of Chantel's, we're just going to go on the idea it's a skin infection. We're not going to go through her differential diagnosis of boils. Boils are carbuncles or whatever it is. Skin infection.
I mean, I don't know if I'll complain, but I'll complain that the advertising link. Okay, where does it say? I don't see at all where it says on the Amazon. It doesn't say that anywhere. And that's where I'm buying it from. So it just says here.
See, this is somebody who's a diabetic, who's a type 2 diabetic, who has, it seems, a non-healing skin lesion and is more concerned about the scooter and this, that, and the other than the other thing, which literally could kill her, just to be honest. I have had a lot of patients that have died who were type 2 diabetics from skin infections. Because if you don't take care of it and it becomes a necrotized fasciitis and she's not clean and she can't look, it can become a killer. And I've seen, I've had some of them, they are the most horrific wounds I've ever seen. Like, it will strip your skin away. It's not something that I would just be so laissez-faire about. I would be petrified if I was Chantel. I just find it absolutely, she's making sourdough starter down there. She's making more like a gangrene. That yeast is long gone.
It's supposed to be heavy duty. Like, it's supposed to be heavy duty. It's still overweight, but it came super early. I was surprised. I was like, what the hell? Yeah, on Amazon just says 330. Exactly. Yeah, it's pounds. Yeah, Laura, Amazon says max 330. So that's a friggin' false advertising. Regardless, it's false advertising.
I'd almost be more scared of a non-healing lesion on a diabetic than anything with her heart or anything at the moment. That would petrify me. Those things never heal on diabetics. Half the times they can't even feel the pain or discomfort because one of the things with type 2 diabetics is obviously if you start to get neuropathies, which I'm sure she's got horrific neuropathy because her diabetes is so uncontrolled and has been so unmanaged for probably 10 years now. That's a really long time to have poorly controlled type 2 diabetes. The way I already know she's poorly controlled is if you have a patient and they're coming in with like, they're like her 10 or whatever, I converted it over on her A1Cs or her blood sugars, and you're getting sugar scores like that all the time, or your hemoglobin A1Cs are high, you're gonna you have to have more control. Like, if you have a patient who's like that, the advice from the American Diabetic Association is that you have to like hit that with like some hardcore diabetes medications. Like, you want to get them on the Ozempic, you want to get them on it's like you don't want to get them on insulin. You try to get them on like maybe metformin, but there's other drugs that you may use, but you're going to go hard and try to get that blood sugar under control as fast as possible so that you don't get them to have like insulin resistance, so that they're having to start taking actual insulin, which she's already reached that point. She hasn't taken care of anything. She's the really, she's very badly managed. This is a nightmare patient scenario.
30 extra pounds would be a big difference.
Terrible.
I wouldn't have bought it at all, yeah, they're like $2,000 or more. They're very sturdy. I can't afford a bigger scooter, Tracy, but yeah, I don't know if I'll return it or not. We'll see. Good incentive to lose weight. Yes, cover rounds it can be expensive. I mean, I didn't think it was that big of a deal. Like,
good
I thought
yes.
it would take forever. I'm like, okay, I have room to.
Yes, insulin is not insulin. Yes, you don't want to be insulin dependent, especially coming from somebody who maybe isn't, a type 1 diabetic, which is very different from a type 2. Type 2 is generally is from lifestyle, and exercise and eating, and it is a drug, it is a disease. Often it's caused by lifestyle. Type 1, not so much. Type 1 is you're born with not having a ability to create insulin in your pancreas from your Islas de Langerhans. I sound like my medical term.
Time to lose weight. Maybe it will work just fine. Then I can be like, haha, I told you. That's true. Glitter. Pop Rocket, I just showed the ad.
For you.
It said 3:30. Like,
good for
you.
you.
Okay. Yeah, I'm not worked up. I'm too tired to be worked up. I'm just annoyed that it has to charge long.
Yeah, me too.
I'm a child that way. Patience is a virtue. That's what I thought. I would just have to lose 14 pounds in a month. Scooter.
I am sorry to hear that too, Anne. Right, 3 times a day. Yep, kidneys waiting because the kidneys are going to go. It causes a lot of stress on the kidneys, having to work all that blood sugar out of the kidneys. It's a lot of strain on the kidneys, a lot of stress and strain. So unfortunately, and that's one of the things that we have talked about a lot on this channel. And also with this particular creator on YouTube, with the registered dietitian, because Cheekbones had specialized. Also, she got her grandbabies now, so she's busy. But they, we have always spoken about, and she specifically, because she worked with diabetic patients and worked with patients having dialysis and going into this type of issues with their kidneys. And we've spoken about that extensively and at length about her kidneys actually and her needing to go to dialysis. In fact, I have one where I literally have like a picture of people, sitting on the dialysis machines, I think is a thumbnail. I brought out a video about people getting dialysis to show just how antiquated those dialysis machines are. It is so bad. And she's a big lady too, so she'd be there for hours, and it just takes over your life. And then, that's also goes along with that bad blood pressure too. Their blood pressure is skyrocket high, like 202 over 110 is not unusual to see with somebody who has dialysis and kidney failure. And it is you have them on every drug that is known to mankind that you possibly can put them on safely, and you still may not get control. I've had these patients coming in to cardiac rehab, but for the not cardiac, but respiratory rehab. And, I've had their therapists come over and ask me, because the blood pressures would be so high, and we'd be trying to do all these tricks to like get their feet up and all this stuff, elevate the legs and whatever we could, just to try to start to get that blood pressure lowered down. just so they can, get 10 minutes on an exercise machine in the hopes to start, but it's horrible. It's really bad. And this young lady is only going to be 42 years old this birthday. And this is the condition that she's comfortable being in, which is astounding. And doesn't care that she's a type 2 diabetic with a non-healing lesion. You don't know your boils, Chantel. You don't even know what your feet look like, girl.
It's too dainty, I think. Why are they so small? Like, I've spent $500 on worse. That's an old lady casino scooter. See? This
The old lady casino scooter. Chantel would like to be as healthy as those old folk.
This is the exact same
Her
one
organs
on
are
Walmart.
80.
330.
That's $939. Well, Chantel, you're going to have to go to a specialty medical device company to get one that's actually going to be appropriate for you. These are for, like, when they say for seniors, do you see this? Mobility scooters for seniors. Most of these little senior adults, they eat like little birds. It's very rare, unless it's a big guy, to see them past the 330 mark. I've had some females actually, and I'm thinking I did have a female patient, and we had to take her in a wheelchair, and we had to put on this like specialty weighing equipment on the wheelchair to weigh her, and it was a to-do, man. She was well over 300 some pounds. I think she was a little bit tinier than you, Chantal. So, yeah, that's for like little adults. It's not to roll people who are, weight challenged around, who are 40 years old.
30 pounds. The exact same scooter for $939 at Walmart, and it was $5 something. That's why I'm telling you, I bought it. Oh, shoot. Oh, my God, that's expensive. Oh, this one is 350 pounds.
She's going to have to go to a medical device company. Did I get any questions? But back then, it was only insulin. You had no other choice. Yeah. Oh, I'm so sorry. Well, that was, and now, medicine has gone further. It's a thing is medicine is still a fairly new science, and we have the complexities of the human body, and everybody is a little bit different. The anatomy is the same, the way the things work are the same. How everybody treats their body is not the same. I guess is kind of that's the environmental part. All right, keep going, Chantel.
It's $2,000. So like $2,000. So I would have to save. What is this? 265 pounds, 300 pounds. This one for 1,700. This is the one I really want. It goes up.
Why don't you put this much effort into trying to find out how to get walking, or swim? You just need to be in a pool and doing something, Chantel. You got to start slow.
To 500 pounds, and it's an 800 watt motor
therapy, because she's never going to do this on this own. The only thing that Chantel really would be able to do that really would help her, she actually has to get into a structured program where they literally like restrict her calories down to nothing, and it's being watched and monitored. It's really the best thing, but she never would give up control like that. And that's the problem, is Chantel thinks this is her control of stuff, where in reality she's no control over her health at all. None. She's all her talk about she just glow up or get skinny. She has, just got to a place where she's always going to have some type of health issue. Like there's always going to be ramifications. Even if she like did something well now, maybe she won't go into kidney failure or something. But the type 2 diabetes, that's always going to be there. Especially with her having to use insulin now. That's never good once you get to that place. You never are not diabetic. So that's to be clarified. You can, become a pre-diabetic and then you become diabetic, and then even if you get your numbers back into control again, you're still a type 2 diabetic. You're just in control. And so it's only ever to be managed to that point. You're never going to like reverse the disease. There's no such thing as that. And that, you know, as much as people want to talk about reversing diabetes, you can get good control, but you'll always have the disease.
Duty 1,700. I might return this one. That one would be perfect. You could take that thing on the long road. Yeah. Yeah.
You like that? Wow. Yeah. Well, there's still, oh, I saw this. There's still a lot of stuff regarding the things with the eyes. That I lived in a certain area in North Carolina, and there was a lot of this specific like cancer of the retina that was happening in that area, and they were trying to figure out why. But there was a few cases, but it was like all dotted around this one area. But yeah, I think there's still a lot to be learned. Okay, so let's take a look at this real fast. This is 2015. I think this is the most recent I could find. This would be kind of what you would find. So often, you know, if you're a family practitioner, you may look at many different practice guidelines if a patient came in, and these would guide you as you start, you know, especially as you begin your practice, you know, as to what to do, keep you current on your practice and so forth. And so obviously, anytime you have any type of skin infection, and basically the underlying tissue happens when germs enter through breaks in the skin. So whenever you have breaks in your skin, and Chantel, potentially from having like friction over time, because isn't it, she says it's on her fupa area, you know, and if it's, you know, rubbing, or she has it like in a moist area, or that's, you know, kind of tucked into clothing, and she already has, you know, skin that's going to be more fragile with her unmanaged type 2 diabetes. So your type 2 diabetes is not under control like hers, you're going to have other things that you're going to be more prone to. And there's always, like, because of the excessive sugar that's going to be within her blood system, that is actually going to make her types of wounds much more susceptible and much more difficult to heal. So she's not only going to be more susceptible to getting any type of infection with a break in the skin from a germ getting in through there, you know, it's pretty bad. Anyway, okay, I'll make sure there's no questions. I haven't missed any. I hope I haven't missed any questions. I think I asked this. What about gestational diabetes? Oh, well, gestational diabetes, that's specifically for gestational time. So that's really just through pregnancy. It's horrific though. And I think once that's just, you have to be careful that when you become pregnant that you would not have that particular issue again with the gestational diabetes. But that's specifically something that happens to a woman when she's pregnant. It's very different from type 1 and type 2 diabetes. Good point. Thank you, Anne, for bringing that up. Yeah, it's very different. Yeah. Hereditary. Yeah. It's I think it runs more in families, the gestational diabetes. So if you had somebody in your family had gestational diabetes, you have a greater likelihood. Now, if you do have some issues, you know, potentially where you're bordering between like say pre-diabetic areas, and you're not aware, and type 2 diabetes, and you get pregnant, there is potential that you could get into the gestational. You were able to get it under control. Yeah, that's good. Yeah, you can always, you're always going to be considered a type 2 diabetic in your medical chart. From a medical standpoint, even if you've reversed it, and it's what you would be considered like diet controlled. Because if you're no longer on medication, but you're doing it through like how you're controlling it through food and not spiking your blood sugars, and obviously lifestyle choices like exercise, you would be considered a diet controlled diabetic. But it would never be, you would never have that taken off your chart. You're always going to be considered diabetic. Yeah, that was a great question, but thank you. Yeah, that's how you'll always be considered in your chart. Yeah, but they'll just call it, like I said, diet controlled instead, which is great. Congratulations. That's a really awesome thing to do. You should be proud of yourself because that's not easy to do. And you should be proud because not being on the medication is so much better. That just means that you understand that your pancreas obviously has limitations with how it's able to produce insulin in order for you to open up the insulin is needed to open up the cell walls and actually allow the sugars into the blood cell in order to produce its, energy. That can be in your blood cells. It can, and do its job. So it's a good thing because you don't want to overflood the zone with too much sugar because then you'll have too much of it and not enough keys to open up the cell door. Okay, so back to food. I hope I don't miss any other questions. Oh, you're welcome. That's great. Yeah. I don't blame you. I'm somebody, the reason why I'm so fascinated with healthcare and medicine is really to not have to be somebody who takes medications. And I always have encouraged my patients to try to make lifestyle decisions lieu of having to take tons of medication. Now, certain medications, once you reach certain types of illnesses and things, you are going to have to potentially remain on those medications because they're beneficial, because they may be working in conjunction with certain processes in the body. And so it's, it's prophylactic, it's, potentially more protective for the person at the end of the day. But obviously, even as people get older, de-prescribing, as we call it, is still very much a topic in trying to get people off as many meds as possible because it can potentially lead to cognitive issues in our seniors and so forth. So I think that, is, most people in healthcare don't, you are encouraged to find ways not to prescribe medications. It's why we're always, highly encouraged to teach our patients about things like flu and how antibiotics are not effective for those, or colds, or any of those things, and not just to give antibiotics out like candy. And so I think, there's, because science and medicine is still so new, I think that, there's still a lot of educating that goes along with it. But yeah, that was awesome. I'm proud of you. I had a grandmother who had type 2 diabetes and did not do favor so well. So I'm always proud of people who do. That's why I've always been so interested in it as a patient population too. So here, boils and abscesses are examples of simple skin infections. These kinds of infections are more common in children and older adults. Chantel is definitely in the children range, but that's only in a mental area. Yeah, diet. Oh, absolutely. It's down to diet. It really is. And exercise too, because you need to get at least a good 15 minutes of brisk walking or something, because you need to put that little bit of, and as you get older, you need to be adding weights in order to really help with stuff too. So you can't, the walking alone is not beneficial as we get over 50s and 60s. You have to start doing the weights, and that's for the bone strengthening. And that also helps with blood sugar control and many other different things. So it's, and there's so many good experts that you can find on YouTube who are physical therapists specializing in over 50 exercise and recommendations, and will give you motivation for stuff. There's so many things if you find yourself limited or just are interested. So much better than someone Chantel. Chantel should never talk about topics around health. She's canceling doctor's appointments, and she's gonna get this issue anyway. I just want to check the chat. Okay, these are infections more common in children. and older adults, in people who are frail or malnourished, and in people with health problems like diabetes or HIV, which is, what I had been saying about her being type 2 diabetic. She is going to be more prone to these, and they're not going to heal very well. Symptoms are obviously pain, swelling, redness, and heat near the infected skin. And then more severe infections can cause fever, vomiting, weakness, or drowsiness. So if she ever started to get any of these types of symptoms, that could be a sign that that skin infection is actually starting to cause her some complication. And then obviously the concerns always come around MRSA, which is methicillin-resistant Staphylococcus aureus. And that's obviously one of the germs that is extremely difficult to treat and can be controlled with many common use antibiotics. And it causes nearly 6 out of 10 skin and soft tissue infections. So Chantel is not aware if it's not healing. And the reason why it doesn't really heal is because it's MRSA. Because if it's become MRSA, which if she's not clean down there and stuff, it's very has a very high propensity to have that occur. It could get really bad. And then if she's, if it starts to become bacterially resistant, you're going to have some issues. You really are. You're going to be on a lot of antibiotics for a long time. And, antibiotics have obviously side effects like diarrhea. So she definitely would have to be on, very good probiotics and prebiotics and every type of biotic you can imagine. I'm not laughing, but she's always pushing her doctors off, and she doesn't have control of her diabetes. She doesn't see people about her feet. She doesn't see dentists about her teeth. And all the yeast on the skin, which, she's going to have from obviously the type 2 diabetes too, it's going to give her, again, greater propensity to these infections. Oh, my God. Okay, keep going. Okay, so if it was a simple infection, she needs to get antibiotic ointments or pills. Sometimes doctors use a scalpel to cut open the wound and remove the pus. Patients with serious medical condition or very bad infections might need to be admitted to the hospital as surgery. So basically, if it's not healing and she's just ignoring it and she thinks she knows her skin and it's a bacterial infection, because often what they'll want to do is get the pus, believe it or not, that's why they may land to you and actually get that into a tube. They'll make sure before they get any of it out, they get a container and get that swab, get that sample, and actually find out the exact bacteria causing the infection in order to appropriately give an antibiotic. Giving some type of broad spectrum like a Bactrim or something like syphilis, something like, oh gosh. There's another one. Clindamycin. I should remember that one. I'm allergic, highly allergic to clindamycin. Something that's more broad spectrum. It's not going to necessarily, it could help to say, control the infection maybe, but may not give complete curing of that infection. So somebody like Chantel, if it's really a boil and it's been persistent, then she needs to make sure she doesn't need an antibiotic for it. And just slapping any type, like I said, antibiotic on it isn't really going to be the answer to curing it. So yeah, she needs to get that seen too, because you don't want it to come MRSA, because then she can't treat it. The last, great antibiotic that can be given is vancomycin. which is really, I would not want to ever be on vancomycin. If I broke out on hives the way I did with clindamycin, I would not want to think what would happen to me on vancomycin. It would, because you can get also something called red man syndrome. I would have the worst time. They would have to put me on like probably a Benadryl drip while they gave me that drug. As long as I'm on Benadryl, I can get through it. But I really am very allergic to that medication or that family of antibiotics, which is not good for somebody like me who works in healthcare, because were I to get, an infection and where I have more exposure potentially to MRSA and stuff just around because of my patients and so forth, more ability to have it actually inhaled because it lives in your nasal passages. So most of us, if we were to have, you can't take Cipro. Oh yeah, oxymoxicillin gives you highs. Those are the cillins. You're in the penicillins. So you have to maybe be careful around penicillin potentially. You can't do that. Yeah. You got to be careful. Yeah, clindamycin. Oh my God, the hives. Yeah, you can't take the Cipro. You stay motivated. Yeah, you stay motivated. It's okay. Yeah, you got to always be kind to yourself. Yeah, absolutely. Self-care. Those boils usually pop up with, yes, uncontrolled diabetes. I had one last many years before. Okay, but they tested me then and said I was not diabetic. Obviously, they were wrong. Oh, yeah. And the good thing to do, too, is to, especially if you have, like, other conditions like Chantel has, is to make sure they do get a swab of it, it's sent to the lab and actually find out the exact bacterial cause of that particular infection in order to get the right treatment, because that's going to save you a lot of time and frustration, especially if you're diabetic, because you're going to have a really hard time healing something like that. So making sure that you're getting the appropriate treatment and wound care protocol is going to be really important. My concern is that, like I said, if she keeps going, the only, like I said, they put you on something like vancomycin, and vancomycin has a lot of side effects. And worst side effect is too, obviously, if you're not having it heal and they have to put you on long-term antibiotics, which no doctor likes to do, and you're not taking good care of your intestinal health during that time, then you get Clostridium difficile. Then you're into a real issue, because that stuff is highly contagious. Like nobody can, C. diff is horrendous. It's horrendous. And it all comes from like extensive antibacterial administration to patients who are very sick and getting all these different infections and all this stuff. Pardon me. You get that often with cancer patients. Oh, it's horrible, horrible, horrible. Just the worst. I just can't. When I had my, yes. Well, that's right. Cause I was on clindamycin and Bactrim, and I was on Bactrim for 6 months, and the clindamycin was what made me so ill, I think, along with the Bactrim. And that was the one that really, when they put the two together, and the clindamycin, my allergic reactions to it and stuff, it was bad. It was really, really bad. It was so bad. And it wiped me out. I lost so much weight. I could not eat. My doctors obviously had the concern around the getting the diarrhea, which then if you see that, if you're taking antibiotics and it's the seedy, smelly diarrhea, then you need to let somebody know straight away, because that's potentially C. diff, Clostridium difficile. And It's not anything to be messed with. It's nasty, highly contagious, nasty stuff. Like, you have to go in there into a patient room with that, like fully gowned, like strict like protocols, it's exhausting because they already, and then because of it and the diarrhea, they're just going all the time. And you can't have them sit in it, but it's this nasty, contagious stuff too. And it's just like, it's all come because you gave someone antibiotics. It's amazing what the human body can do suddenly when it's just not working well, like creating diarrhea out of it seems like nowhere. Like, the person's not even eating. It's like, where is this water coming from? And it's like highly contagious and will give you get near it and you don't wash your hands or you get on your clothes, you don't know, you could have C. diff yourself. And nobody wants to get C. diff. Chantel has had C. diff. I know, and it's nasty. This is nasty. It's so nasty. It's so nasty. No, I've never had C. diff. I've never had C. diff. I just want to clarify. I personally have never had C. diff. I never got it, okay? Because I did very well with taking all my antibiotics. I've had to work with a lot of patients who have had it. Immunocompromised patients, too, with cancers. Not me. I took care of my stomach. I didn't ever get C. diff. God, no. That was a concern of my healthcare provider because of my long-term antibiotic. That's why they don't want to put you on antibiotics, for long-term, because of that high risk for that stuff. So you've got to be very good about that. And I think because I was another healthcare professional and I did not want to get it. And I spent a lot of money on pre and probiotics because I could barely take down anything. So I had to take just like Culturelle. It worked. It worked. All right, guys. So Chantel is gonna push off the doctors. So I'm guessing she's no one prescribing her. I understand that she can get her diabetic medications maybe over the counter without prescription in Canada. But maybe she's paying for it out of pocket without an insurance card at this time, or she got the insurance card, but maybe she needs the physician prescription. I don't know how it works in Canada. Does anybody have any questions that are like burning questions that I haven't answered just around this topic? If you do, let me know. And if not, I'm going to say thank you guys so much for your time this evening. It's been lovely catching up back in girl world. She did. Well, I know she got her benefits back. So maybe she did. Historic diarrhea is no joke. Oh, God, no. It's really not. It's a lot more serious than you think. Just like the skin boil is a lot more serious than you think. And I think this is good advice for anybody, is that these types of infections, especially if they're not healing, I would definitely seek the advice of a medical professional, because a lot of times these can be either a bacterial or it could be a fungal yeast. And if you get like a folliculitis or something on your skin, she could be having a yeast infection. But if it's a boil, that's going to be with pus, that's indicating a bacterial nature. So you're not going to have like a pus-filled boil if it were a fungal infection. So we can rule out the yeasts. Not to say that the yeast on the skin hasn't led to her having higher propensity of germs on the skin. And therefore, the minute she has a skin break, which is very easy with friction, if you have warm, moist skin areas, ladies with large breasts probably know this, that you can get your skin excoriating between the breast tissue just because of the moisture that builds up. So you can get a moisture associated skin deterioration known as MASD in the clinical world. And this type of moisture-associated skin deterioration, which I'm sure Chantel, between a FUPA or something, is very prone to, will cause breaks and opens in the skin. If her skin is breaking and opening, she is potentially going to have bacterias into those areas, especially if it's down where she's pooping and peeing. And if she's not being very clean or hygienic down there, then, you could think that potentially an E. coli bacteria that is coming from her stool, or having the staph already on the skin, because a lot of us, that's why we have to keep clean, is getting into that opened area and getting in there and causing that potential boil to happen. So why is purple a scary color in medicine? Where is the purple being seen? Is it being seen on a hematoma or around a wound? Because if it's around a wound, it could be indicating a number of different things. When I think of purpling around a wound, especially sort of like pressure ulcers on the skin, and obviously you have varying levels of pressure ulcers, but they start out red, but they can get purpled. Could mean like vascular problems, potential that it's becoming necrosing. Purple could mean bruising. So it's just really dependent. But yeah, purple things can often, but it's going to be dependent on where it's happening and where you're seeing the purple from an exploding boil. Well, I mean, seeing that type of purple sort of skin around the boil or anything like that is going to be an indication that your body is really sending like its entire army of white blood cells to that area to try to fight that infection as best as it can. So you're going to be taxing your immune system more in order to try to combat or fight any of those infections as well. So it could be just a sign of more activity coming from your body as it kind of sends in its forces to try to attack and do what it can do to try to combat and combine. When I think of things about purple, I often think about, big, especially for me and dealing with cardiovascular, like huge hematomas, or with like when I think about if you haven't had a good entry into a vein when you're doing any type of infusion medications, it could be indication that you are entering into the patient's skin with a medication rather than the vein. And that's going to be really bad. That is the extravasation of the medication into the skin is not a good sign. Yeah, it could be all sorts of stuff. Yeah, it's never good. Yeah, it's not good. But thank you for the question. I appreciate it. I'm late to this. Does overuse and yes, Scale over. I was just touching on that topic about how if you have a overuse of antibiotics over time and you've not been taking any type of pre or probiotic or postbiotic, or making sure that you're caring for your intestinal health, you have a very high chance of getting C. diff. And because you've killed off basically all your intestinal flora. And so it has a chance for this particular very bacterial resistant infection to occur, which is C. diff. And you would then have to probably go on another antibiotic, which could cause you potentially to continue with the C. diff. And so it's like you don't want to. That's why C. diff is so bad. because, you're going to have to be on very strong antibiotics to get to C. diff. That's why it's so important not to just take antibiotics for a flu or a simple cold, and to really only take them when very, very needed. That's why not only do we have these sort of like super bugs that are very antibiotic resistant, like MRSA, there's even, other more super ones. So, you really want to make sure that, and then people have allergies, like, we've discussed here that people are sensitive, and then you have to, only certain antibiotics are going to work for certain types of bacterial infection. And the broad spectrum ones, are going to kind of control it, but it may not really treat or target what is happening. And so it's very complex, and there's a lot to be considered by a practitioner when prescribing antibiotics. But if Chantel has a boil and it's been persistent, it could be simply a topical cream like a mupirocin that needs to be applied. Usually you'd only use it for 10 days and then you would take it off, because like any antibiotic, anytime past that, it stops being effective, and therefore, and then you may not ever be able to use it again in the future, because you then, become resistant to that actual antibiotic. Some may have to be used with stuff. Shingles on the skin is terrible. Use shingles. Shingles are awful. Shingles are really, really bad. I do always recommend to get your bivanacular shingles injection, if you can, starting at the age of 50. It also is evidence showing that not only is it obviously good for shingles prevention, it is also potentially good at warding dementia. There's some studies coming through that having that, because you're not having that, not getting shingles, it seems to maybe, or something with the actual vaccine may have a prophylactic effect with dementias. So I do encourage that, and that's very interesting to hear. Yeah, and I'm sorry about that for the eye. That's very painful. Shingles are extremely painful, very, very painful. And yeah, you should. I would spring for it, Catherine. I would just do it. Just spend the money, girl. It's worth it. It's worth it. I'm sorry to hear it's that expensive. Well, let's put it this way. We had to pay for the healthcare here, which was very expensive to get to the, comped shingles vaccine with the insurance at the Walmart. I got mine at my local Walmart. But yeah, I would always suggest it. I got it even though I did myself. I never want to have shingles again. I did have shingles. I had exposure to this is the worst story ever. I'll tell you a funny story. I was living in Mexico, and I worked as a school teacher at the time. And I had a class at the time, this was in the 90s, and they did not have the varicella vaccine at the time. And I had a class of children that suddenly came with chicken pox. Not before, and some, and so before, unfortunately, before people start to actually have the visible pox, they are actively having chicken pox. You just don't see the pox. So that's why it gets really dangerous with it. So obviously I had exposure, like without them, before they were all like locked away. So I had exposure to all these kids, and I had had chickenpox as a child. Well, that exposure meant that it turned out that exposure for me ended up bringing out a case of shingles. But I didn't get it in like a usual spot. It was actually inside of my throat. You just never know where shingles is going to come up. Okay. It was so painful. I was having just these horrendous like sweats and exhaustion. I mean, I was a young lady in my 20s. And obviously, if you all know, shingles is part of the herpes family. The varicella virus is part of the herpes family. So I go to a doctor in Mexico who tells me I have herpes in my throat, and I almost lost it because I was married. I'm just like, what is... Didn't think my husband had much of a history before me. So he then had to preface that it was the type that came from chicken pox really quickly. Which I realized I had shingles in my throat, which is a type of herpes virus still, but not the herpes like you think of herpes. Oh, it was, yeah, in Mexico. So the doctor's English was good, but obviously the way he said the name of the virus, you know, oh my God, it was awful. I almost lost it. Oh, and it was, I tell you, it was awful. I mean, for weeks, it took me weeks to get through that. And I made sure I got vaccinated as an adult when they got aged appropriately. But yeah, you can still get it and be young, but God, I got some really odd stuff that never happened to me. But in Mexico, all sorts of Moctezuma's revenge and, you know, dysenteries and, you know, exposure to kids. And also being in healthcare on YouTube, who said she had vaginal shingle. Oh my gosh. Luckily, I've already prefaced this as a trigger warning, adult education information. I'm like going red faced because I'm so embarrassed just telling that story. It's like one of my best worst stories. You had chickenpox in the 70s. You had it in your throat too? I don't feel so alone. It's horrible, isn't it? Yeah, mine was in the 70s as well, Brianna. When, you know, all my mother did was stick me in a dark room. Say, don't scratch them. We know my mother wasn't the most nurturing of individuals. She's like, throw that child into quarantine. Anyway, I do appreciate it, guys. Yeah, I had so much fun. I'm glad you joined us, Ann, on somebody different than Sarasota Tim. I had so much fun. If you guys are enjoying these Q&As, and I certainly enjoy always having a chance to, she said one lip became swollen. Yes, it's really swelling. That was part of why it was it is so painful. My whole throat was swollen up, which I thought originally it was like I was getting you know, like strep throat. I thought I had strep throat. So I've had that before. Oh my God, that's painful too. Had that one time here when I was like in my 30s. Oh my God. I feel like, thank goodness I went into healthcare, and I seem to have been like pinpricked and vaccinated for everything since then, because I don't get quite as sick except for this nose infection. Oh God, I can't speak. But yeah, it was fun. Nice you came in. Hell's Ice Supplies. Am I getting that right? Well, Chantel isn't that. Make sure you guys do hit the likes on the way out. Like I said, it was fun. Thank you, Catherine, for coming in. Yeah. Oh God. Oh, Catherine. She probably want that catheter in. That's the one time you probably be wanting a catheter. Oh God. Oh Lord. And, you know, that's one of the things as a nurse, you're going to have to think, how are you going to make your patient feel comfortable with all that going on? You know? Oh my gosh. And I wanted to thank Sammy too, and Angel of Glass. I'm trying to find you guys' names up in here. Sammy was here. Thank you, Sammy. I know Angel of Glass was also mod. I had all three of you guys in here. I appreciate it. I don't think I'll have the energy to go live tomorrow night. I know Wednesday nights I do members only, and it's getting spicy, guys, for the Tim stuff. Just to finish out on the Tim, my outro is going to talk about me being the Sarasota queen. So foodie appropriate, but it is Zach, so that makes it foodie appropriate. It's foodie adjacent. But Tim said something about maybe not having some money, not being so rich anymore. It was in my video I did. If you listen to the line, I think I know what he's indicating, but we'll talk about that on Wednesday. But yeah, so I'm guessing he's reading his emails. Maybe he's reading his mails. Catheters are great. Well, unfortunately with catheters, you can have catheter associated urinary tract infections. And if the person who is actually inserting the catheter did not use good sterile technique, and you probably want to have two technicians there, then you are very likely to get a infection. Used to be, I think, people going into surgeries, they would just kind of put catheters into people, kind of stop people from having to pee on those cells or keep things clean. But if you're like being operated on your face, they're not going to put a catheter. They're just going to put you on a pad and let you pee, because they're not going to try to do anything that's going to be introducing infections into somebody. Tim's not rich anymore, Sean. Well, the thing with Tim is he made a comment about he said his usual line about the fact that, what is he? How could I not remember Tim's line? About him always saying, but I've got plenty of money. That's it. I got plenty of money. He said, at least for now, anyway. And the way he said it, I think I know why he said that. And everybody who's a member of the Good Life will find out about that on Wednesday, because it's getting spicy. And Tim's dropping the Easter eggs about it in his videos. So that makes me know that what I sent is being read. And that's all I'm going to say, because I'll give the game away. Your fibroids. You would like to be in the catheter. Well, I mean, that's the thing. There's times too, as a nurse, it's better for the nurse and the patient, because if they're just, miserable because there's no control. But now they have these things, and I don't know if it would work, but maybe with fibroids it would. But no, because you have to be on a suction machine. They put these Pure Wicks. You have to know how to position that Pure Wick too. And if you don't get the suction right on those things, you can hurt a lady. So it's an art setting up a Pure Wick too. I haven't had to set up one of those in a long time. I would not claim to have the art of setting up a Pure Wick like I used to, because I do pediatrics and my kids aren't. You see, it's just cooking. On this wonderful conversation about skin infections and carbuncles. My goodness, Angel, you're brave. All right, guys, I'm going to actually head on out, but it's been a pleasure. And like I said, I'll keep you posted on any of the other events that we have going on. And I just appreciate everyone being here tonight. Like I said, make sure you just hit the likes on the way out. It's been a pleasure. I don't usually do foodie, but I'm going to see if I can try while I've got the time, because obviously I've got to try to start concentrating again back to my clinical rotations, and I've got to find a preceptor. If I spend all my time doing YouTube, I'm not using my time to do the stuff, and I just literally just run out of time. And it's just, I just kind of feel like I need a school break, but I need to make sure I get back at least in the next couple of weeks into the grind of it all again. But I do enjoy all this instead. But yeah, I came back to go above. That's what I'm hoping. Yeah, I hope you have a great night too. Nice to see you. Yeah, I hope I love talking about Foodie because I really get to talk about some health stuff too. Because a lot of her stuff going on, I have a lot of specialty in. So anyway. All right, guys. Take care. Talk to you later. Bye. Hit the likes.
Life and Vibe, thanks so much. My queen, my Sarasota Tim expert.